We're live on JoyNews desk. Now, President Akufo-Addo on Tuesday break ground for the much-anticipated Agenda 111, which is the construction of 111 hospitals. The president last year pledged to build hospitals in all districts without them in 12 months. Information Minister Kojo Oppong-Nkrumah on Sunday announced that government has so far secured 88 different parcels of land for the construction of 101 district, 6 regional, and 2 new psychiatric hospitals.
101 district hospitals will commence on Tuesday, the 17th of August, 2021. The project will also see to the provision of 2 specialized hospitals, one for the Middle Belt, one for the Northern Belt of the country. These are psychiatric hospitals. And then a redevelopment of the Accra Psychiatric Hospital. There will also be the development of 6 new regional hospitals and 1 extra regional hospital for the Western region. The District Hospitals project, as you recall, was first announced in April 2020 by President Akufo-Addo during his 8th COVID update to the nation. And it is programmed to take between 12 months to complete each one from the point of commencement. Now, since its announcement, the Project Implementation Committee, chaired by Chief of Staff, Madam Akosua Frema-Osei-Opare, has been delivering a number of objectives. 1, to secure the physical location of 101 sites. Currently, they have secured 88 of those 101 sites. Not just securing the physical location, but also securing title to the parcels of land, 88 out of 101 so far. And each of these parcels is about 15 acres to be able to do the kind of facility based on the architectural drawings that they are putting up. They've also been procuring the services of consultants. You know, for all of these projects, they are what you call project consultants. They've also been working to secure funding for it. Currently, commencement funding of $100 million has been made available to the project through the Ghana Infrastructure Investment Fund. For the projects themselves, it's budgeted at nearly $17 million for each of the district hospitals. The district and specialized hospitals are being funded by the government of Ghana, but for the regional hospitals, EPC arrangements have been made that come with their own funding associated with it. Contractors for the various projects have also been procured and are commencing work, with the first set starting from this week. Preference was given to local contractors and local labor, because it will also be the demonstration of what we call Ghanaian excellence. That will, among other things, showcase what the Ghanaian construction and engineering community is also capable of doing. The project is expected to deepen healthcare delivery at all district levels and ensure that the Ghanaian can access high-quality healthcare at all district levels. It will also provide thousands of jobs for the healthcare staff who are going to be recruited and posted to these 111 facilities across the country: district hospitals, specialized hospitals, regional hospitals. It will also provide jobs for the ancillary workers, beyond the healthcare workers themselves. In every one of these facilities, you have ancillary workers who provide services that support the core healthcare exercise that is going on there. And then there's also critical housing that is being provided attached to these hospitals.
Now let's speak to the advisor and former chairman of the Coalition of NGOs in Health, Dr. Gabriel Benaku, for this. Thanks very much for joining us, sir. Now, this promise was made in your time as chairman of the coalition. We are now seeing that there will be a sword cutting for it tomorrow. What do you make of the timing of this?
Yeah, thank you, and good morning to everybody in Ghana and outside. We appreciate the move by government, as we have always when I was the national chairman, we have a lot of information in all the districts in Ghana. And at that time, on your platform, after the minister announced, we said that it was not possible.
Pardon me, please speak up for me, Mr. Benaku. It's very difficult to hear you.
Yeah, I said at the time I was the national chair, I was on your same platform, which I challenged government that it was not possible for them to have been able to do it within that short period. At that time, there was no stakeholders consultation. At that time, we didn't know how much the health facility would cost. What is the standard for health facilities at the district level? What is the standard for regional or referral facilities at the regional level? And so we are happy that government has been able to, as they say, they have been able to mobilize resources to pursue what they call the Agenda 111. So we will continue to play our part as a civil society, but the issues still remain. In Ghana, we have not addressed the sociological aspect of health. How are stakeholders properly engaged? When you secure funding and you put up a facility, and you are not able to get the stakeholders to buy in, the facility will be weak. And that is what has happened in the previous government. From we all know, from Rawlings, from Kufuor, from the late Professor Mills, we have seen infrastructures are still there without use. So that is because we have not used the social aspect of health. We have not involved stakeholders. So they are not part of the sizing of the facility.
So this is something that you would encourage government to do, to involve more stakeholders so that these facilities are not abandoned.
Yes. If you count now, you can still get my records are confirmed because I left just 6 months ago. But at the time I was leaving, there were more than 55 health facilities at district and sub-district and community level that were completed by the government and they were not being used by the current government. It's just because we have not sociologically involved stakeholders. We have not recognized the other political parties' contribution to health. We have not recognized the private sector contribution to health. So government tends to initiate new projects without completing health facilities. And I think as a country, we need to change that myth, that perception, and that attitude of not using facilities built by previous government.
Gabriel Benaku, thank you very much for joining us this morning on News Desk. Now, we stay with health because the Ghana Health Service has admitted there's pressure on COVID-19 treatment facilities in the country. For weeks, the country has been experiencing a surge in cases attributed mainly to the spread of the Delta variant and the lack of adherence to the COVID-19 protocols. Now, according to the Director General of the service, Dr. Patrick Kumar-Boaje, though there is pressure because some patients are discharged when they recover, spaces are created for new persons.
Treatment centers. Yes, there's a lot of pressure on our treatment centers. No doubt about that. But as people get discharged, spaces are created, and that Ashanti initially was bad. It's a bit improved. And so it may be good today, may be bad tomorrow. But that's the more reason why we want to ensure that people don't catch the virus, and also no matter what you do, if we don't protect ourselves, all our beds will be full and we'll not even have enough health workers to manage them, because the health workers will also go home because they are exposed. When it comes to the schools, so far, a total of 453 schools have recorded cases of COVID-19, with a cumulative total number of students who are reported positive is 3,113. 95.6% have recovered. We still have about 136 active cases. The last time we were here, we had about 504 active cases. So that outbreak in the schools seems to be under some control. I'm sure the protocols and things have been, the schools have
start adhering to the protocols. But we have 49 cases still in Ashanti. OT has 40, Volta has 21, Bono East has 10 cases, Greater Accra incidentally had only 6 active cases. Western 4 have 3, and Eastern region has 3 active cases of school children who have been lost. So far, we've not had any mortality apart from the one we reported who was a sickler and also had that. Volta region has recorded the highest number of cases, especially in schools, but systems have been put in place. Teams have been sent there. Teams will be sent there next week as well to go and see how we can support the region in its response. Northeast has still not reported any case in their schools. And the Ghana Health Service and their partners have initiated systems. We already, since the onset, we've submitted structures.
Meanwhile, Health Minister Kwaku Agyeman-Manu, in his first press statement since the Sputnik V vaccine controversy, says his actions since assumption of office have been to protect the public purse at all times and also safeguard Ghanaian lives, especially during the pandemic. Now, former Special Prosecutor Martin Amidu has also waded into the controversy with his latest epistle. In the 4-page document, Mr. Amidu says, "This is therefore the time for all patriotic Ghanaians to wake up and with open eyes cease to be like Thomas, whose eyes could not see at this crucial moment of our dear nation's history that requires each of us to sacrifice to defend the 1992 Constitution and put Ghana first." End quote. We move to other stories, and Roads and Highways Minister Kwesi Amoakwata is this morning visiting the areas in the Upper West region which have been hit hardest by Thursday's flood. Vehicles and passengers were stranded on the Nadoli-Babile, Nadoli-Juapa and Sombodong highways after the downpour washed sections of the road away. This brought economic activities to a halt. Now, Rafiq Salam is with the minister's entourage and he joins us live. Rafiq, has the tour begun and what has the minister been saying? Unmute your microphone, Rafiq.
Hello, Daniel.
Yes, if you can hear me, has the tour begun? What has happened?
We are at the Upper West Regional Coordinating Council expecting the arrival of the Minister for Road, Honorable Kwesi Amoakwata. We are told that the flight will delay. It was earlier scheduled to take place at 9:30, but the itinerary of the minister goes this way. He will arrive at the Wa airport, and then after that, will be briefed by the Upper West Regional Minister who chairs the REXEC, and then later they will use the helicopter to move to some of the affected areas. And then later, we will meet him at Goriri, where one of the places that was worst affected by the floods. And so currently, we are still at the Upper West Regional Coordinating Council waiting for the arrival of the Minister for Roads.
Now, over the weekend, Rafiki reported that people were stranded, economic activities had come to a halt because of the roads that had been washed away and the general effect of the floods. What's the situation now?
The situation in the Upper West region, I can tell you that it's not only different. It's not all that. It hasn't changed much. The only thing that has changed probably is the water that has receded in some of the communities. But more communities are still reporting about this issue of this flash flood. A typical example happens to be at the River Wahabu, which is located around the Wolambele enclave. And so for now, that place is also cut off. So for people from that community, Wolambele are going to Kowia, other communities, they cannot come to work unless they will get back to Tumu and have to do the 85 kilometers. And as we speak to you now, Fancy 2 is also cut off, talking about the district capital of the West. And so they are also cut off. And so it has moved from 6 districts now to 8 districts that have been affected by the floods.
Mm. And how are people managing? You're talking about the people having to change their routes to travel 85 kilometers and what have you. What are the people telling you?
The cost of transport in the Upper West region now is now higher. Jiroba, if we were to go to Jiroba, which is about 62 kilometers, goes for 20 cities. And now the cost of going to Jiroba now is now tripled 60 Ghana cedis, because one has to move from Wa and then take a turn on the Pin Road, and you move to Jaffa. And so transport fares in the region have now have sharply gone up.
Now, Rafiq, finally, I know that a number of these people are in need of aid. A number of these people have had their livelihoods washed away. Has NADMO come to their aid?
NADMO was there, but NADMO, they are helpless at the moment. NADMO can't do anything about the situation now because they themselves are cut off. Let me tell you, the interesting thing is that NADMO has their central warehouse around the Jirapa enclave, and so even now they can't even have access to that place, even to help the people. So for now, NADMO is helpless, and they are saying that they are waiting for the engineers to give them the alternative route so that they will go to those areas and then get in touch with the affected victims in order to support them.
So let me get this straight. The relief items that should go to those who are being cut off have been cut off themselves.
Yes, that's true, because on all our travels, we went with the personnel of the Upper regions and NADMO, and they can move from one end to the other. And so they themselves are cut off. And so the director was saying that they have to wait for this alternative group when they are spotted on, and then they will move into those areas to help the victims. But let me also tell you that there are fears that some major roads in the region could also cave in because you can see that some are saturated. We have our rivers, lakes, and streams. They are now swollen up. And so any further rains could spread further danger for the region.
Thank you very much, Rafiq Salam, for bringing us those updates. Now, the Upper West Regional Minister, Dr. Hafiz Bin Saleh, is asking for help to aid the region's recovery from last Thursday's floods. Hundreds of commuters and vehicles got stranded, as you heard Rafiq report, as a result of the heavy downpour that washed away several bridges in the region. Though the extent of the damage is yet to be known 4 days after it occurred, Dr. Bin Saleh assures that government will do everything within its power to fix the roads that are being cut off as a result of the torrential rain.
It's been 4 days since the torrential rains in the region, and still this is happening. On what used to be their streets, commuters now walk, some barefooted, carrying all personal effects to cross through the receding waters from one end to the other. More and more people are not willing to risk through the water, though it is receding.
Wait small and see, maybe by 3 we'll leave.
I mean, when you go back to her, when will you be able to go? Because the road is cut.
We'll wait if they do something about it. If not, we are in trouble. You see, the other side they can't cross, which we can't cross.
Yesterday we are about to come, and they said that the road is no good. So we just waited till today that we know that the place will be fixed. So we don't know that this place too has just also spread like that. So we can't go. We have to take another vehicle that can take us to it. So I would like to tell the government that they should help us. It's not all of us that are here. Something we are about to come. So
Flash floods destroyed major roads and cut some parts of the region from its regional capital. Farms and economic trees were also not spared. The scale of the flooding here is immense. The landscape of one of Ghana's poorest regions perhaps changed forever. It has slowed down economic and social activities in the region, and the consequences dire. It is an epic crisis that has never been witnessed by the people, and the region's chief executive, Dr. Hafiz Bin Saleh, in the company of RECSEC members, came to see things for themselves and to offer the support of the government.
What has happened is really going to affect the economy and even the social life of the people of the Upper West region. We all need to brace ourselves for the difficulty that we are in now, because a lot of people will be inconvenienced, particularly those of us who trek often. We're going to be affected. So we need to brace ourselves for the difficulties that we are in for now. But like I indicated, we are going to approach this issue headlong. The police would need to up their game. Vehicles that are plying this route, they need to place people at the center, that is why, so that they direct them as to where to pass, so that they don't come here and then get stuck.
The National Disaster Management Organization, NADMO, though on hand to support the affected victims and communities, are not able to do that for now. At this stage, they cannot even begin the recovery. They are here for sightseeing.
We could hear from the engineers still telling us the other alternative routes to pass to the communities. So it will be very difficult as of now to tell the number of people that are displaced and the number of farmlands that has been washed away by the flood. So unless we wait for the engineers to come up with the alternative routes, for myself and my team to come in and see what is that we can support the community or the affected individuals as of now.
The major worry for now is the threat of the alternative routes also caving in and cutting off more communities so the region has more rains as forecasted by the Meteorological Agency. Some of the grounds are already saturated with water and the rivers and lakes swollen, a sign of perhaps more disaster in the making. Reporting for JoyNews, Rafik Salam, Goroyiri.
And later today at 8 p.m., JoyNews' latest hotline documentary, Crushed Young, will be premiered in Kumasi. It's a story about how children lose their lives to road accidents. Ahead of that premiere, the AM show has been speaking to the president of the Pediatric Society of Ghana, Dr. John Adabie-Appiah, who is asking governments to set up an emergency fund to help victims of road accidents. We hear from him in a bit, but first let's bring you extracts of that documentary.
Today, I am out on the graphic road here in Accra to meet a young woman who has been a victim of road traffic accident. She is called Naomi Ado. She lives around the graphic railway slum, 600 meters from the graphic road highway. Tears build up in her eyes, and even before I engage her, she breaks down.
Because many that's why I'm in Bano. See that you baby papa be and they are shaming. And to miss me, you home. I'm assuming in the course. See that she be obey at the papa be mammy. So, you know, but sure, Uncle see Aga. On a many year maybe be a me Babette or friend auntie Naomi, friend me mad. They be auntie Naomi and no one on the frame. Me did me be a balance and edgy, Mammy and Cassa.
On that day, Naomi saw her 8-year-old class 2 daughter off to school, hoping they would reunite later in the day. This, however, became a mere wish.
Benaku school, until all Bano, and a traffic light in Ejuma. Until you know when we say into all Tremuno, not cabin so every overhead so sunny, until a born and a rush in the hospital, and in the hospital, you drew on. I say.
On that day, Naomi was so sick that she wasn't able to rush to the Kolebu Teaching Hospital to see her daughter.
On that catcher, we collapse here. It is Benitiana, behind the half, and I'm beside, and I must you see. Zuman in the Benicia may
collapse. When the first car hit her, a second one ran over her at the graphic road traffic light intersection. According to hospital records from the Kolebu Teaching Hospital, her pupils had dilated and was bleeding from the nose and mouth by the time they reached the hospital. She also had a deep cut on her forehead. Her dream of becoming a journalist ended right there.
When we start mentioning children in this society, children from this level of society and what their loss means to their families, then we probably will start sitting up. For example, if it's an only child, for example, if it is a child born out of so many years of trying to have a child, or a child.
It's been 4 years.
Let's now hear from President of the Pediatric Society of Ghana, Dr. John Adabie-Appiah, who is asking governments to set up an emergency fund to help victims of road accidents. He spoke to Israel on the AM show.
their family and those who are providing care also need that psychosocial support as a result of the trauma they also face aside the primary injury.
Yeah, Dr. Adebiafia, you make the point about these children being victims in accidents and the bills that they leave the hospitals with. Unfortunately, often, or in some of these instances, the parents or the guardians of these children die, which also means that you can actually bill the kids, and so you don't really have much of an option. Is there a way out?
Well, thanks very much. My personal experience in hospital and as an intensivist during this period, especially managing such cases, what we think must be done is that we need to have a system where all road traffic accident patients are actually identified, linked up with insurance companies who should quickly provide support for paying for their medical bills. National health insurance doesn't really cover intensive care unit. And most of patients, when they come to the hospital, either we don't have emergency medications available to support them. If even we do, just for 24 hours. And after 24 hours, the families will have to go around looking for resources. So it's a whole burden on the families who actually manage who sit beside their kids and then also extended family members who sit beside their kids in managing cases, looking for funding. That is one of those things, but that's one of the things that can be done. We need emergency fund for emergency medical care funding to provide care for such cases.
Now, the Ghana Health Service in the Ashanti region is holding a news conference today to address the public on the rollout of the Johnson & Johnson COVID-19 vaccine. Ashanti Regional Health Director Dr. Emmanuel Kojo-Tinkrine is speaking now.
Continue to work together as a team. And I would like to take the opportunity to congratulate the media. You've done so well in this fight, and I believe that the partnership will grow so that at the end of the day, we can control the pandemic, and then all of us will be free and then continue with what we are already doing. So thank you, and then let me take Yo, ever say I don't pay your share?
And that was Dr. Emmanuel Kojo-Tinkrine speaking there from the Ashanti region, wrapping up his news conference there. Now, we know that 177,000 Johnson & Johnson single-shot COVID-19 vaccines were delivered to the country last week through the Africa Vaccine Alliance Trust AVAT program. Now, we also know that the Ghana Health Service decided to focus the distribution of this batch of vaccines on hotspots. So naturally, the concentration will be on the Greater Accra region, which was receiving 100,000 vaccines, and the Ashanti region that we are told is receiving 50,400 vaccines. Now, as at the 15th of August, that is Sunday, 11,000 persons had been vaccinated in the Ashanti region, because we know that the exercise began on Friday. Now, Friday, if you watched any of our bulletins, you probably saw Himing Teria reporting from various health centers in the Ashanti region, where they said that personnel were being trained to administer the vaccines, and some persons were also receiving their jabs. Now, in the Ashanti region, A similar news conference was held, the Greater Accra region, a similar news conference was held on Friday, where it was officially announced that the centers will be put out and the actual vaccination will be done from today. We'll be sharing with you shortly which centers will be available for you to access these Johnson & Johnson vaccines. Also, we'll be connecting with our reporters who are monitoring the activity here in the Greater Accra region. But I believe that it's time for us to take a few messages. We will come back to you with more stories after this. Stay with us.